Hey guys, it's Stephen Freeborn here from freeborntrainingsystems.com, and real quick, I wanted to actually take you guys through a technique for working on mobility, specifically mobility meaning range of motion with control. And it's actually a technique that I learned by attending a course called the Functional Range Conditioning Seminar. And it's a system that's been developed by a chiropractor out of Canada named Dr. Andrea Spina. Great course, highly recommend it, whether you're a coach or maybe someone who's just very into taking care of themselves, optimizing their performance, moving better, feeling better, looking better. Couldn't recommend it enough. But I thought this particular technique, which is just a very small piece of the actual system, could be really beneficial for a lot of people. The only problem with the technique is it really takes a lot of intensive coaching to really learn to do it correctly, and takes a lot of then practice after being coached how to do it correctly to get a effect from it, because true changes in range of motion or true changes in tissue take time. They're not immediate. If range of motion increases very immediately, it's not usually a restriction of the tissues, but rather kind of a neurological problem. The emergency brake was on, in a sense, and you released it. But this drill is specifically, or this technique is specifically to help with actually attacking the problems at a tissue level. Which is probably something that you should really deal with a coach, so they can kind of target the areas or the problems that really are a tissue or a capsular problem versus something that's a neurological problem where the emergency brake is more so the issue. But anyways, I definitely think this is a very useful technique. It's something called PAILs and rails. PAIL stands for progressive angular isometric loading. And rail stands for regressive angular isometric loading, which simply just means that you're going to take a particular joint and a particular set of musculature to a end range position, and then you're going to hold that position kind of in a traditional static stretch for about 2 minutes or longer, and then in that elongated or shortened position, depending on if you're talking about the regressive tissues or the progressive tissues, you're going to then contract those tissues in those elongated or shortened positions for about 20 seconds, pulling towards the regressive angular load and towards the progressive angular load, which the progressive would be the elongated, the tissues that are being stretched, and the regressive would be the tissues that are shortened. One of the best drills to kind of demonstrate this on is a simple 90-90 hip stretch. It's a great drill too because most people can benefit from it. Most people have kind of tight bound up hip capsules, and this particular drill really gets at that. Combined with the PAILs and rails techniques, it's kind of it's a game changer in my opinion as far as actually gaining mobility and truly opening up the hips. So the way you get started is you're going to assume the 90-90 position, which is essentially one leg's bent at 90 degrees in front of your body, and then the trailing leg is also bent at 90 degrees. But now it's pointing back away from your body, so it's trailing you. You're going to try to sit up as nice and as tall as you can, and you're almost going to think about accentuating that curve in your lower back. I like to start with the front leg. It's probably the best leg to start with, most comfortable. The trailing leg is pretty uncomfortable, but we'll get there. So like I talked about earlier, this is essentially just starting off like a static stretch, a very traditional static stretch, only we're going to be very mindful to make sure that when we're leaning over that front leg, we really are feeling the stretch in the outside part of our hip, kind of on the outside part of our butt cheek on this front lead leg. If you're not feeling that, really think about pulling that chest up, taking that chest to the ceiling, leaning over that lead leg until you feel that stretch. When you feel the stretch, there's nothing else you need to do except hang out there, relax. Remember, your breathing when you're relaxing into static stretches is like yoga breathing. It's very slow, it's not tense, it's not short, it's deep, it's long, no holding your breath, just relaxing into that position. Now, if I was really going to do this and work on it, I would hold this for 2 minutes. But for the sake of the video, we're just going to assume that now I've held this position, in this elongated position, or the shortened position for 2 minutes. So in this position right now, as I'm relaxing here statically, my adductors, the stuff on this side of my leg, is the regressive tissues. It's the tissues that are being shortened. On the other side, on the underneath side of my leg, those are my progressive tissues. Those are the tissues that are being elongated and stretched. So to start, we're going to start with a progressive angular isometric load, or the PAILs part of the PAILs and rails, which means that all I'm going to do is from this stretched position is I'm going to start to ramp up a contraction, pushing this knee, this foot, and this entire leg through the earth. It's like a battle I'm trying to win, trying to shove my leg through the ground and increase that stretch, essentially, but contracting that tissue at the same time. So what this will look like is a slow ramp. I usually start with a 5 count, so you'd start 5, so you're ramping up the contraction, 4, ramping up the contraction more, and as I approach 1 on my countdown, I should be trying to get to maximal tension, maximal isometric effort into that floor. It's a high tension strategy. If you're below 80% on an isometric load, you're probably not getting the beneficial effect we want. So think high tension, like you're trying to shove your leg literally through the earth. So you can grunt. You're going to be gritting your teeth. You're going to think about tensing your entire body up, tightening your abdominals, shortening your breath. Very short, choppy breaths, increasing that intra-abdominal pressure as you ramp up and drive that leg through the ground, and you're going to hold that PAILs contraction for 20 seconds. So here's what it's going to look like. We're going to ramp it up. 5, 4, 3, 2, 1. And I'm thinking about driving that leg into the earth, winning that battle, tensing the rest of my body, irradiating the contraction through my body. 20 seconds is what I'm shooting for. Keep that contraction even. Don't relax. And then let go when you hit your 20-second mark. Now, what I did was I stopped contracting so that I can talk you through the next part. But I want to make it clear that there should be, when you're actually practicing this drill, no break between your PAILs contraction and your rails contraction, which is your regressive, those shortened tissues. So what would have happened if I was really doing this drill for real is at the end of that PAILs contraction, as I'm shoving my leg through the ground, I'm going to go right into my rails contraction, which means I'm going to try to increase the stretch, not by simply moving my body into position, but by using my actual musculature on the short side of this stretch position to pull myself into my stretch. So I'm thinking about pulling this foot up. I'm thinking about pulling this knee up, squeezing with my abdominal muscles and my adductors of this lead leg towards each other, trying to bring myself deeper into that position. So to resume where I left off is, as soon as I finish that PAILs contraction, I'm immediately going to go now ramp up into a rails contraction where I'm pulling myself into that stretch deeper, deeper. I'm pulling with everything I have. Remember, we're trying to get about 80% effort. If I was doing this correctly, I really wouldn't be able to talk through it. But the idea is to pull yourself hard into that stretch. Hold that contraction. Maybe you're going to get a little bit of a cramp. That's okay. Fight through it. Fight through it. Keep the contraction even, consistent. Once you hit your 20-second mark, you'll relax. And you'll notice when I did my rails contraction, I pulled myself deeper into that stretch position. So I'm getting an even elongated position. After my rails contraction, I can simply just stay in this new elongated position, relax for another 2 minutes, and repeat my PAILs and rails cycle. I can go through those cycles as many times as I want, but you're going to notice that you're going to get a little bit less of an increase in that stretch, in that increased stretch position after each cycle. So I may be with you for 3-4 cycles through the PAILs rails, increase the stretch, 2 minutes, PAILs rails, maybe 2, maybe 3, maybe 4 times at most, and then go ahead and switch to your trailing leg. Now, as I said, the trailing leg for most people can be really uncomfortable. It can almost feel like you're going to dislocate or maybe break your femur or that upper bone in your leg. I know it sounds weird, but it's okay if you're having that feeling, because the way right now we have your body oriented and the way we have your hip joint position is when we go to stretch that capsule into kind of an internal rotation as we push that leg towards the ground, there's not much musculature to pick up those forces. So those forces are going to kind of go directly into that capsule, and then that capsule becomes the bone. And so we're going to kind of feel that in that bone, in that capsule. It's going to be discomforting, but I promise nothing is actually going to really fracture, or dislocate, or break. It just feels as it is. So if you can get through that discomfort, it will really be beneficial. A lot of people lack internal rotation at their hips, which, interesting enough, is an early clinical finding for people who develop arthritic hips. So if we can keep our hips, plenty of internal rotation, stay moving correctly, hopefully we'll reduce the chance that we develop some kind of arthritis. So for our trailing leg, the procedure for this is the same, and it would be for any position you're going to put your body in to do PAILs and rails. Whatever stretch you want to add the PAILs and rails technique to, you're going to simply get into a position that you feel the stretch. So for our trailing leg, for our front leg, we're trying to feel that stretch on the outside of our hip. On this one, we're trying to feel that stretch through our down, kind of our down legs inside groin, our muscles on the inside of our leg, and then we're trying to feel it on the kind of wraps around the back side of our hip and down the front. And that's kind of that feeling of like dislocation or fracture that a lot of people get kind of scared by. It's okay. That means you're doing it right. I know, weird. But same procedure. So you'll get to that stretch position when you start to feel that stretch. So for this, we're going to lean over that leg. We're going to reach back around towards us. Now, the key here is to find a place where you can hold your balance, stay comfortable, and keep the stretch for 2 minutes. I know it sucks, but it's worth it. If you need to, use your arms. If you absolutely need to. If you need to, get some kind of prop to hold you and pull you into that stretch position. If you need to, relax there. And just like for my front leg, if I was doing this correctly, I would pretend that I was going to hold it for 2 minutes. And then I would move into my PAILs and rails. So for my PAILs and rails contraction on this leg, is my PAILs contraction is going to be trying to lift. So I'm trying to lift this leg off the ground, right? I'm trying to pull that leg up towards me. Oh, no, sorry. You're going to get confused to get the PAILs and rails contractions correctly. But so for my PAILs contraction, it's the tissues being stretched. So if you ever forget, just like I did, remember, PAILs contraction means the tissues being stretched are the ones that are contracting. Regressive, the tissues that are being shortened are contracting. So to start, for my PAILs contraction, I'm going to try to contract my adductors, that groin muscle on the inside of this trailing leg. I'm going to think about driving it into the ground, trying to push myself off the ground, pushing that knee into the ground. So I would push that contraction for 20 seconds, just like on my front leg. Then for my rails contraction, it's going to be pulling myself closer to that knee and pulling that knee closer to me as I try to move the inside of my hip closer to the ground. Again, each one of those contractions you're going to do for 20 seconds. When you get to that deeper stretch position, you're going to hold, relax, another 2 minutes. Again, just like with your trailing leg, you can really repeat this 2, 3, maybe 4 times at the max, and then go ahead and move on. And it's going to take repeated practice, repeated exposures to these positions and these contractions for these mobility changes to stick and actually truly stay. But because we're implying stretch, so we're increasing our range of motion by kind of detoning that muscle, and then we're applying force and teaching that muscle how to contract at those elongated positions. So we are truly kind of releasing the brake and allowing those tissues to adapt to stimulus that's being applied. So what you do is after you did your front and your trailing leg, you could then switch and do the same thing on your other side. And again, you'd lean into your position. Hold your stretch. PAILs, rails. Hold your stretch. Repeat. Trailing leg. Stretch. PAILs. If I confuse you, I'm sorry, I confused myself. PAILs on your trailing leg would be into the ground. Rails would be away from the ground and pulling yourself deeper into that stretch. So I think this is a really great technique. I think it's user-friendly. I personally think that if you're going to really get a lot of benefit out of it, you should seek out an FRCMS, which is somebody who's trained in the system, that's been to a course, who's been coached on it properly by Dr. Spina. But I think that this is too beneficial of a technique not to put out there and not to share with you guys, so you can truly start seeing improvements in your mobility and not spending all your time stretching and putting a band around your joints and then having these transient changes and having to repeat that time and time and time again. So to recap real quick, PAILs and rails, progressive angular isometric loading. Rails, regressive angular isometric loading. PAIL simply means we're going to contract the stuff that's being stretched for really, really hard, greater than 80% effort, hopefully 100% isometric effort. And then regressive means we're going to contract the stuff that's being shortened or the stuff that's not being stretched on the opposite side of the joint for 20 seconds as hard as we can. And this technique can really be applied to any passive stretch you can think of. This is just one that kind of demonstrates it in an understandable way that's not too convoluted or complicated, and most people can practice it and get down, and a lot of people can benefit from doing this particular stretch. So if you guys have any questions, please let me know. I'm sure I stumbled over my words a little bit. I'm sure part of my explanation at the beginning wasn't completely clear. Maybe some of my logic and justification might have been a little bit off, but it's pretty on point. The idea here is that we're using technique and applying a force to our muscles, to our cells of our body, to induce a stimulus for them to react to. In particular, what we're doing with PAILs and rails is we're trying to get a passive stretch, elongate that tissue, open that tissue up, desensitize it, let it release, and give us more range of motion. And then we're going to teach that muscle how to function, how to fire at those elongated and those shortened positions so that we reinforce that mobility and keep that mobility. Instead of just stretching, gaining the range of motion, firing back up, working out again, and then that range of motion shrinks back down because our nervous system doesn't know how to control that large range of motion. It doesn't feel safe there. It doesn't want to let us go there. So if you have any questions, please let me know. You can call me, text me at 417-540-8870 or send me an email at sfreeborn7@gmail.com. And if you're ever interested in working with a coach, maybe somebody who can specifically help you with mobility using functional range conditioning, or somebody to help you look better, feel better, perform better, please let me know. I've got an awesome coaching program called The Process. It's pretty kick-ass. So anytime you're looking for a coach, give me a call. Hope you guys have a great week, and I'll talk to you later. Bye.